I'd like to welcome Dr. Laskovich today. Thank you for joining us.
Thanks for having me, Athena.
We're filming a short on craniocervical issues. Can you explain the overlapping issues in persistent misalignment, craniocervical syndrome, and craniocervical instability, and then speak about how they differ?
Sure. The persistent misalignment generally equates to the passive inability to maintain alignment. So our muscular system and our nerve system senses misalignment, guarding or governing the muscles to contract and or relax to realign misalignments. When you have damaged ligaments, then you have the propensity to have persistent misalignments because once something is aligned neuromuscularly or through way of a manipulative adjustment, the passive ability to hold that position is has lost its integrity, and so therefore you are always susceptible under the guise of having had ligament damage to misalignments or malpositions, which will require some form of manipulative techniques to realign and or neuromuscular treatment techniques to allow for proper activation of the neuromuscular system to maintain alignment. And those are two systems that inevitably don't have the ability to permanently last. So the temporary benefit wears off with some undetermined amount of time, whereby you either need a realignment and or a reset of the neuromuscular response system so that alignment can be maintained. And so craniocervical instability would be the prime example of that. Now we have craniocervical syndrome, which can easily be caused by craniocervical instability and oftentimes is caused by that. So they are interconnected. And basically the craniocervical syndrome is a term coined by Dr. Damadian, who invented the MRI, to indicate that these so-called head problems or brain-related symptom problems that were being seen weren't actually being caused by brain pathology, but were being caused by a bottleneck in the junction between the brain and the brainstem / spinal cord, thereby calling it craniocervical syndrome. Is that the syndrome of symptoms, which is just a multitude of symptoms that are very overlapping with the numerous patients that present this way, are not being caused by a brain pathology, but are being caused by a bottleneck in the brainstem region, which then manifests further upstream into the brain, causing pressure changes in the brain. But the pressure changes in the brain aren't directly being caused by a change in the brain, but they're being caused by an alteration in generally mechanical forces or things being in the wrong place, causing the fluid dynamics of the brain to be altered. So you could get something, akin to what would be potentially called hydrocephalus. So there's extra CSF being pooled in the brain, thereby putting pressure in the brain. But the reason it's pooling there is not because too much is being created. It's because the same amount that's being created is not equal to the same amount being drained through the brainstem region or the upper cervical spine region, so the craniocervical region, thereby terming it craniocervical syndrome. Is that the syndrome of symptoms comes as a result of something occurring at the level of the craniocervical junction. Does that make sense?
It does make sense. And then would you say that craniocervical syndrome, whether or not instability and excessive motion applies, both of those cases comprise a type of persistent misalignment which affects CSF flow?
Yes, absolutely. So when you have this Fielding-Hawkins malposition of the C1, C2, you do actually constrict that region and cause a functional stenosis or a functional narrowing, which then equates to the drainage tube coming through that region being slightly compressed. And when it's slightly compressed, say you're making 10 cc's of CSF in the brain, which is where it is made, and you're only draining 9.5 cc's every time that the circulation pump goes, you're always having a half a cc backup into the brain, and eventually enough accumulates that it actually starts to cause pressure that relates and causes then symptoms to start arising, such as brain fog, such as headaches, such as dizziness, nausea, blurry vision, just to name a few.
Right, that's an important point. And then Dr. Bolognese also mentions in his explanation of craniocervical syndrome that, to your point, it's a constellation of symptoms. Yeah.
And
So
yeah, that's the word syndrome really means a constellation of symptoms. Anytime the word syndrome is used, it means that there's just a multitude of symptoms that are very similar in presentation to those people. So they give it a defining term such as craniocervical, so where it's likely arising from, and then because there's a multitude of symptoms that patients can have, they'll slap the word syndrome there.
Thanks so much, Dr. B. To hear more on this topic, go to this craniocervical video, which is on Dr. B's injury resource site and also on Craniocervical Canada YouTube channel.